Welcome to 9 on 9, our new weekly show here on KTSM 9 News. I'm Daniel Marin. Thanks for being with us. Each week we dissect a topic impacting the borderland through longer form interviews and analysis that we can't always bring you in our regular newscasts. It's 9 questions and 9 answers with a few follow-ups if needed. Tonight we are joined by Dr. Alozie from the Texas Governor's Infectious Disease Preparedness Task Force. And we're going to be talking about the reopening of Texas, the lifting of the mask mandate, what you need to know about the vaccines available in El Paso right now. Also, we're going to talk about those new CDC guidelines and even some advice for spring break. We got lots to cover, so let's get started. All right, Dr. Alozie, thank you so much for being with us tonight.
Thank you.
So Governor Abbott has reopened Texas 100%. The mask mandate is reversed. What do you think about that?
I mean, there's a couple of things to think about it. I mean, I think the governor has it well within his purview to make his decisions. And I've said this multiple times before, that when you think about the public health, politicians aren't going to protect our families. They're not going to protect our kids. And so each individual really has to make a decision on what are the things that protect them. And what I really prefer to have a conversation about is, throughout the COVID process, we've kind of gotten stuck in this do or don't do, right? You're a good person or you're a bad person because you wear a mask or you don't. And I think that what we're finding is that we kind of failed with it, right? It's why we had all this dichotomous aggression. And everything you do has a relative risk. And each individual has to decide what that risk is. I mean, if you're outside, your risk is really zero, essentially, right? Now, if you go inside a packed room with 100 people that haven't been vaccinated, very different than being at home with people that have been vaccinated. And so I think the key is people got to make some of those decisions on their own and be as safe as possible.
Question 2, speaking of being in rooms with people who have been vaccinated, the CDC issued the guidance this week saying that people who have been fully vaccinated can visit others who are fully vaccinated indoors without a mask or social distancing. It can also visit with unvaccinated people from a single household without masks if those people are at low risk for COVID, younger, or have no comorbidities. And also, if vaccinated people are exposed to someone who is COVID positive, there should be no reason to quarantine if they are asymptomatic. It's given a lot of people a lot of hope, but of course the variants are still out there. How big of a threat do you think that is? Can we be a little excited?
Yeah, I think we should absolutely be excited, right? And I'm super excited about the vaccines. I understand the variants, whether it's variants of interest or variants of concern. We need to track them. Historically, I've done a great job of tracking them, but we've gotten so bogged down with sort of the sky is falling mentality of COVID that nobody wants to remember that in all the countries that had the variants of concern active when they were doing the trials, the vaccines worked. Hospitalizations were 0 cases. Deaths were 0 cases. And so, yeah, the variants are of concern. The people that manage variants and research them, let them do their job. Our job is to figure out how to get as many vaccines into our community because the vaccines work.
On the topic of the variants, this is a question that no one's really been able to answer for me. I don't know if you could, but how do we know when a variant arrives in El Paso? Are they screening for it constantly? How does that work?
Yeah, it's part of the surveillance system. And so the CDC has an active surveillance system. Unfortunately, it wasn't a very robust system in 2020. One of the changes with the CDC is that they're deliberately and actively getting those samples sent to their research labs. And the research labs have the ability to determine whether it's the UK variant or the South African variant or the Brazilian variant, and they're looking at it. Right now, the variant is estimated to be anywhere between 15 to 25% in the United States, and in Houston it seems to be rising even more. We haven't gotten any information specifically that it's in El Paso, but the expectation is that by sometime April, May, it'll be the predominant variant in the United States.
Is every sample in El Paso sent to the CDC? How does that work?
Yeah, no, absolutely not every sample. It's a sub-sample of samples, right? So say we have 100 people that are positive, 1 to 10 of those samples will be sent off and they'll look at it.
I want to get your thoughts on the potential for a 4th surge. We have some experts saying that we might be in the eye of the hurricane, not necessarily coming on the other end of this. How likely is a 4th surge?
Yeah, again, I mean, I've said a lot of times, I hate being Nostradamus, right? I'm not a fortune teller. I don't think we're going to get there. I think that people understand that masking is important. I think some people are taking to heed or to heart the advice about double masking because those variants do seem to actually spread between one person and another more easily, and I think that's important. But what's also important is that as those variants are coming online, we're also getting a lot more people vaccinated. We're protecting 50 to 70% of the people that are most vulnerable, the above 75s and the above 65s. And remember, we're getting teachers vaccinated, we've already gotten the majority of the healthcare workers vaccinated. And I know there's a long answer, but if you really think about the fact that well over 100,000 people have been a known positive, and we know that we didn't catch all the positives, so maybe 30%, 300,000 plus people in El Paso have already gotten COVID. We're ramping up vaccination. I truly believe in the next few months, by this summer, we'll get to a point where we're reaching that imaginary sort of herd immunity that can reduce spread, and that's the exciting part.
Well, we're just getting started here on 9 on 9. Up next, where we stand when it comes to how long the vaccines could protect us. And still to come, that advice on spring break. Stay with us.
The simplest things, like a cloth face mask, prevent the spread of the virus and help us protect each other.
We had such divisiveness in our country that even simple common sense public health measures took on a political connotation.
And welcome back to 9 on 9. We are speaking with Dr. Ogachika Alozie here. We're asking him questions about the vaccine, all sorts of things when it comes to the coronavirus. Now, I want to talk about the Johnson & Johnson vaccine. It's one dose, of course. A lot of people are excited to get it because they want to get the one dose, get it over with. A lot of people, though, do not want it. They see it as maybe inferior. What do you think about that?
Yeah, again, this is one of those failures in sort of communication 101, so focused on that sort of bottom line number of efficacy, right? The clinical trials, 95 versus 72%. But I think people need to understand that the reason COVID-19 or SARS-CoV-2 as a virus caused a worldwide pandemic that put us all out of sorts in 2020 wasn't because it causes sniffles and body aches and joint pain. It was because it could kill people. It was because it could overwhelm our hospitals. If you look at that as a driver, all of these vaccines to date have had no cases of death and no cases of hospitalization. Now, I'm not saying that people should get one or get the other, but if I had my choice, one shot that's going to protect me and my family against dying, I'm going to get one shot over two shots, especially if you consider the fact that there are multiple people that have gotten one shot and now can't get a second shot. And so again, we as physicians primarily, public health, and hopefully the media will understand that are there questions of efficacy? Yes. But again, we're not in this situation because of a cold and sniffles. We're in this situation because of hospitalizations and death. And in that area, all the vaccines are the same for now.
A lot of people still wondering whether someone who is fully vaccinated can transmit the virus to others. This is, of course, a big question that we need an answer to. Where are we in that process about finding out?
Yeah, the CDC issued that guidance yesterday, and I think it's just version 1. It's chapter 1 of this conversation, because the CDC's job is not to be a venture capitalist and guess. They're not supposed to be bullish or bearish about it. But I think what we do see is whether it's from the Moderna data, the Johnson & Johnson, AstraZeneca, and those are trials, or just look at the real world data from Israel, the Mayo Clinic's published, we're seeing it in the United States. In people that are vaccinated, the transmission and asymptomatic ability to carry is reduced, a minimum of 66%. Some people are estimating 80 to 90%. So again, I'm really excited about what the vaccines can do. 2 vaccinated people, 10 vaccinated people 2 weeks after their second dose, get together, engage. We have to give people that hope that the vaccines are going to get us there. Because here's the reality. If you get a vaccine and you have to do everything you did in 2020, what's the point of getting a vaccine? And I think that is where we're going to get people that are younger, potentially at less risk, to get the vaccine. Because if they understand that they can spread less, that gives them another reason to get it, to protect their friends, families, and coworkers at work.
What do we know right now about how long the protection lasts? Is this going to be something that we need to get every year alongside the flu? Maybe just a booster once every 5 years? What do we know?
Yeah, I think it's a little bit too early. I mean, it's sort of the common mantra is 90 days. But I think we're really seeing from a lot of data that's out there, it's not about the antibodies. It's about the T cells. And the T cells have multiple branches, whether natural killer or helper cells. Those seem to last much longer. We have data from other viruses, and especially the 1918 pandemic, and people that lived through it, that they still had T cells tested now, right? And so we may need a booster if these variants actually do become a concern. But all the data, again, right now shows that the vaccines are able to produce antibody levels much higher than the variants can escape from. Exciting news. Again, variants, schmariants, we can't get wrapped up into all that. Get the vaccine when you can. Protect yourself for today. Let the scientists and the science worry about what happens a year from now or 2 years from now. We can't worry about 2 years from now when we haven't figured out today.
And you get whichever vaccine they offer you, right?
Absolutely. I mean, if you're going to get J&J, Moderna, Pfizer, whatever's available, take it. Don't be a vaccine snob. That's just, I mean, that's biting or cutting off your nose to spite your face.
All right, we're going to have some more questions for Dr. Alozie when we come back. You are watching 9 on 9 here on KTSM 9 News. Thanks for being with us.
If grandparents have been vaccinated, they can visit their daughter and her family, even if they have not been vaccinated, so long as the daughter and her family are not at risk for severe disease.
And welcome back to 9 on 9. Tonight we are talking to Dr. Ogachika Alozie about the progress that we are making when it comes to vaccines and all things COVID-19 right now. How would you say El Paso is doing when it comes to administering vaccines?
Yeah, I mean, I know there's a lot of frustration in the community about, hey, I can't get a vaccine, I call, I get online. Understood. I think we do need to pat ourselves in the back even for a moment and remember that for our population, El Paso is doing the best in Texas. At the end of the day, the city, the county, whatever clinics, they don't determine supply. Supply comes from the national government to the state, then the state distributes it however they want to. And so what we know about El Paso is that we get vaccines. We know how to give vaccines. When the supply comes in, it's given out. And so people need to be a little bit patient.
We reached out to some of our viewers for questions, and one of the questions that we got is people who have had adverse effects to antibiotics. What do they need to know about getting a vaccine?
Yeah, from an antibiotic standpoint, there's no reason to be worried or believe that antibiotics affect vaccine either efficacy, how well it works, or is going to drive any side effect. I think there was a recent article out of the New England Journal of Medicine, over 250,000 people, 11 reactions. We have some of the CDC data that shows about 2 to 3 million people, less than 0.1% reactions, all were fine. And so antibiotics are not a driver of any of that we're aware of right now, and so that shouldn't be a problem.
Want to switch to spring break, which of course we are kind of in the midst of. It's gearing up. A lot of families, a lot of young people especially traveling all around. What would be your advice? Just stay home? Can you do it safely?
Yeah, I think we need to sort of get away from the one way or the other, right? I think there are multiple flavors to this. Now, there are families that are vaccinated, they're going to travel and they're going to engage because they're protected. And I don't think you can fault them for that. Younger kids, people that have younger children, whether it's in college or even younger, again, they may decide that they are willing to take the risk. Harm reduction is not about abstinence. Abstinence failed in the 80s and 90s around HIV, and COVID abstinence has obviously failed. And so again, if people are going places, they just need to be safe. They need to mask where they can, try to be outside as much as possible. We know that outside spread is limited, and take precautions. And I really think at this point in time, specifically because the vaccines are beginning to build up that protection in the population, that's all we can tell people.
You were talking about young kids, children, they cannot get the vaccine right now. So what happens if there's a scenario where it's a family and maybe grandpa does not want to get the vaccine, doesn't get it, but the grandkids are still all around? Is there guidance or guidelines to just keep the children masked, I assume?
Yeah, there's no great guidance around that, right? That's one of those little really sticky points or blind spots that we have in our policy. Here's the thing, my conversation with grandpa or grandma would be, why don't you want to get the vaccine? If you want to engage with your kids and your grandkids, Get the vaccine to protect yourself. You're the most at risk for hospitalization and death. We know that kids, especially kids under the age of 10, don't get as sick and they don't spread this as well, right? So again, families have to take those precautions. I would recommend that the kids mask around grandma, grandpa, because they're the most vulnerable, but they got to make some of those decisions on their own as well.
We're going to be right back with some final thoughts with Dr. Alozie. You're watching 9 on 9 on KTSM 9 News. Stay with us. And welcome back to 9 on 9. We're wrapping things up here with Dr. Alozie talking about the coronavirus and the vaccines. You're pretty optimistic, it seems, when it comes to all of this. Do you think we're going to get back to normal? When could that be?
I guess it all depends on what we define as normal, right? I mean, you're talking about pre-COVID. We're not going to be in a normal state probably this year. I think because there are still people that are going to be vaccine hesitant and just refuse to get the vaccine. However, remember, we never lived in a zero-risk environment prior to COVID. People drank and drove. They shouldn't have. People didn't wear seatbelts or helmets on their motorcycles. And so we'll get to a point where hopefully a significant part of our population, I'm worried about our community, right, is going to be vaccinated or have had COVID already, where engaging in the real world will become normal again. I really think that this summer is going to be some sort of Woodstock renaissance. People are going to want to get out. They're going to want to be out and about, and I think it's fair.
We got about 30 seconds left. Is there something that El Paso needs to be doing specifically that other parts of a country don't necessarily have to do when it comes to, I guess, our demographics and how we need to be looking at the vaccines and the virus?
Yeah, I think it's just all about education. It's about making sure that the demand continues to meet up to that supply. We have a lot of people that are still hesitant to take the vaccine, and it's our job, mine and yours and our community, to make sure that they understand it's safe, it's effective, and it gives them that hope to get back to normal.
All right, Dr. Alozie, thank you so much for being with us, sir. And thank you for joining us on 9 on 9. Remember, if you have a topic that you would like to see us cover, just reach out to me on social media. I'm at KTSM Daniel Marin. Have a good night, everyone. We'll see you next time.